So, in relation to my last video about Aruna Khilanani, now, unfortunately, I was pronouncing her name as Arjuna, which, unfortunately, Arjuna is the prince in the Bhagavad Gita that Krishna talks to. For some reason, I thought that her parents had named her after Arjuna. Not the case. So, I misspoke. Her name was Aruna. Dr. Aruna Khilanani was the person that stated that she wants to empty a revolver into the head of white people that pass her on the street that get in her way. And she is also a doctor of psychiatry, and she said this at a lecture at Yale. I said this all in my previous video. Now, there's a link in the description of this of how to get a hold of the Psychiatric Association's Presidential Task Force on Structural Racism, which is headed up by a Dr. Jeffrey Geller. I emailed them regarding this, leaving links, a lot of the links that were in the description of the previous video I had, explaining, we all know that anti-white racism is very prevalent in psychiatry at an academic level, and, this needs to be tackled. Because you have to understand, I'm assuming that when they're saying structural racism, they're working under this assumption that it's anti-brown and anti-black and anti-yellow and anti-red racism, not anti-white racism, which is so prevalent. But as someone that has worked in community mental health and was a recipient of care in community mental health for many, 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 many years, mind you, I was a recipient of mental health care from the age of 7 or 6 to the age of 21 is when I completely, just stopped going. Although I did restart up with DBT therapy and things like that later in life. But at age 21, I completely quit because I realized that it was not really helping me very much, and in a lot of ways, even my former psychiatrist admitted that the medications were harmful, and that was not so much his doing as it was the doing of inpatient doctors and inpatient facilities. But the thing is, what you need to understand is, this is not just a white person problem. This is what people don't understand. Racism should not exist in psychiatry, okay? People should be comfortable with going to the doctor and not worrying about getting an overdose of Clozaril or the doctor mistakenly giving them a poisonous level of a prescription, which is probably what this Khilanani, a woman, could have done. I mean, this is what people are, it's no big deal, it's no big deal. She's a frigging doctor with access to things that could kill her patients, and she is not the only one, okay? And it's not a matter of it being a white issue or a black issue. I mean, this could very easily have been a woman that was very racist against black people. The difference is, if somebody was racist against black people, they'd lack the cojones to say anything about it. The same thing goes for people that are racist against, other people. There was a Jewish professor at the University of Pennsylvania that's receiving backlash for her stating that America might do better if it had more whites and less non-whites, and I'll leave a link to that in the description. Her name was Wax. Her last name was Wax. I forget what her first name was off the top of my head. I'll find the link and put it in the description. But the fact of the matter is, these are perfectly, she was not a doctor. She was not a medical doctor prescribing medications to people. Okay? That's the bottom line. But more importantly, it's important to understand these drugs are dangerous and deadly even if they're prescribed properly. And this is the thing, if the American Psychiatric Association wants to have any credence or credibility, it will tackle the anti-white racism along with the racism against every other group of people. And it needs to tackle racism against every group of people. But you have to understand, for example, a lot of so-called structural racism in psychiatry and in mental health dates back to when it was actually more scientific, okay? Correlating brain size with IQ is not racism. Okay, like when you're correlating the brain size of various races of people with their intelligence as measured by the Stanford Binet test or whatever test they used, that's not racism. That's called science. Okay? However, if you were to say that you hate people of a certain group of people and want to murder them, like Dr. Khilanani did, that's racism. Okay? That's not okay. That's certainly not okay for anyone that's a doctor to be saying this. As, like for example, a private citizen, yes, you can say you hate this group of people or hate that group of people or hate. You have the freedom to do that. A doctor, a medical professional that is prescribing deadly drugs to her patients does not have the same right. Or if she does, like she has the right to say this, but she should not have her career. And people need to contact the Psychiatric Association's Presidential Task Force on Structural Racism to explain that no racism is okay in the Psychiatric Association, whether it's against black people or brown people or red people or yellow people or what have you. But it's not okay if it's against white people either. Okay? That's the bottom line. So it's not okay for a psychiatrist to be this blatantly racist and this hateful. Okay? And like I said, doing psychiatric research, like psychological research, for example, the marshmallow one with the delayed gratification, and Hispanics and blacks didn't score as highly, Hispanics and blacks didn't score as highly with delayed gratification as whites. It might be questionable, but it was not racist. It was a literal science. It's a scientific exploration. It's an experiment. I think that really all psychometric research is really questionable. But some of it, I mean, that, like the delayed gratification thing, that actually does at least smell of science. It's not as crazy as some of the other crap that psychology and psychiatric nonsense puts out there as far as research goes. And the same thing is true, I mean, with brain size and IQ. There's a direct correlation to that, but also what's important to understand with that, that's a legitimate medical, physiological, anthropological research. That's not racism. Despite what people want, just because the facts don't come out the way people want them, that's not racism. It would be racism if they said because somebody has a certain brain size and a certain IQ, they should be eradicated, which is something that probably Khilanani would say. That would be racism. That should not be allowed. However, simply reporting the facts that brain size, larger brained people have higher IQs on average, that's not racism, that's science. Now, there's links in the description on how to contact the Psychiatric Association's task force, the Jeffrey Geller guy, the Presidential Task Force on Structural Racism. Not Joe Biden, that's from their president. Not Joe Biden, that's the Psychiatric Association's president, different president, okay? So there's a link, 2 links, to contact him, although with me, I had to push the button to do it, and then it took me to my Gmail account, and I Gmailed them, or emailed them. And I wrote a nice little letter with the links and all that good stuff. And that's important. It's very important that everybody, whether you're white or anything else, understands the importance of there not being racist doctors with access to dangerous medications. And that's all for this video.